The World Health Organization has launched a suicide prevention campaign focusing on Africa. The aim of the campaign is to raise awareness amongst the public about mental health issues and garner support from governments for treatment programs.
Carried out on social media platforms, WHO Africa's suicide prevention campaign looks to initiate meaningful engagement about the nature, treatment, and possible prevention of mental health issues. It wants to mobilize the support of governments and decision makers to give more attention and funding to programs dedicated to mental health. Officials say Africa has the highest suicide rate in the world, with 11 people per 100,000 dying from suicide. This is higher than the global average of 9 per 100,000. 6 of the 10 countries with the highest suicide rates in the world are in Africa, with an estimated 20 attempted suicides for every successful one. Experts say the situation is partly exacerbated by the limited means of action available to treat and prevent risk factors, including mental disorders.
It's important to highlight that this situation is partly due to lack of adequate action by government, by policymakers, by communities to address the risk factors that contribute to death by suicide. And underinvestment by African governments is the greatest challenge to adequate mental health services provision. On average, governments allocate less than 50 US cents per capita to mental health. This is very low, below the recommended $2 per person for low-income countries.
The continent has one psychiatrist for every 500,000 people, 100 times less than the ratio recommended by the WHO. In an attempt to address this, the WHO is training primary healthcare officials in countries like Zimbabwe to assist in recognizing nascent mental health problems. Advocacy is also underway in Kenya, Uganda, and Zimbabwe to mobilize resources. The WHO is supporting the Cape Verdean and Ivorian governments in their conducting of a national analysis of their respective suicide situations.
I spoke earlier to Dr. Florence Baingana, who's the WHO's regional advisor on mental, neurological and substance use, for more on the campaign. These statistics looking at the rate of suicide across the continent are quite alarming. Please tell us a little bit more about the prevalence and how Africa compares with other regions.
When we come to males, among males, the African region again has the highest globally at 18 per 100,000, very high. And at the same time for females, Africa region comes in second as a region. But if we look at country by country, actually Lesotho has the highest rate for females globally, if we take country by country. So very high rates overall.
Dr. Baingana, have you been able to establish the reasons why the prevalence is so high in the region?
I think it's only anecdotal. We would need to do a lot more. There's a lot more that needs to be done. More research needs to be done to look into the causes. But the causes could include poverty. There's a lot of prevailing poverty in the region. We are one of the regions with a big population of low-income people. And on top of that, we also have access to means of suicide. So the means of suicide could be like organophosphates. For some region, it is very restricted who has access to organophosphates, who can buy them. And also when you do buy them, you need to show proof how you're going to store them and make sure you store them safely. But most of the African region, because of the agriculture, but also because the regulations are not so strong, organophosphates are widely and easily available. So that is one means that is available. But people in the African region also die by suicide through like hanging. Hanging is quite common. So finding a rope, I think, is not very difficult. The other issue is the investment in prevention is very low, very limited. We don't have governments that, except for one, only one country has developed a suicide prevention plan. So as long as we are not preventing suicide, we are going to continue to have rates that are going to be highest in the world. And the reason why the rates are highest in the world right now is because other regions of the world are going down. The rate goes down in the other regions. And even if ours remains stable, it's still going to end up higher than those regions where it was higher. One example is the European region, which had a very high rate in 2000. It was the highest globally, but they put in place a very strong suicide prevention strategy and campaign. And now their rate, as I told you, is 10.5. So it has come down. It is lower than that for the African region. So as long as we are not investing in prevention, we're going to continue to have high rates of suicide.
Let's talk about ways of preventing. You've launched a prevention campaign. Tell us about that and how it will work with governments across the continent.
Yes, the suicide campaign is a social media campaign, and it's actually being led by our comms team. They have developed different modalities. One is going to be media cards that they're going to post. The other one is going to be interviewing people who may have attempted suicide and who may have tried to die by suicide and they survived. Or it could be somebody who says, I know someone. Because we don't like to talk about it. And so if we can find people who say, I know someone close to me that I know who died by suicide, and they talk about the experience and how it affected them, it is possible that many of us actually know someone who died by suicide, but we are not willing to talk about it. So we hope that the more people talk about it, the more we will dispel that taboos and the stigma that surrounds suicide, so that the more we talk about it, the more people will be willing to come forward and talk to a healthcare worker, talk to a trusted other person, a family member, a friend, and get them to help them look for care. Yeah.
What do authorities need to do more of in terms of helping with prevention?
That's a very important one. First of all, I think the authorities need to invest in establishing who is most at risk in our country, who is most at risk. As I started off talking about the data that we are using may not be as accurate as it should be. And so we need to be collecting much better data and understand who is at risk, what are the risk factors for suicide. Is it young people? Is it related to relationships? Is it related to academics for young people? Is it bullying? Bullying is another one that is coming up quite frequently among young people. But if we come to the middle-aged, the elderly, could it be loneliness or social isolation? So if we can understand what the causes are, that would be one way that would help us in designing the prevention. We would know whom to target and how to target them. The other one is if we would need to invest in emergency room technicians, training the healthcare workers who are in emergency rooms, the people who may resuscitate somebody who may have attempted to die by suicide. So very often what happens is somebody may come in, they may have taken an overdose of something, or they may have taken organophosphates, and their relatives find them and rush them to the healthcare center. and they are resuscitated and they are rehabilitated and they are sent back home. We would need that a healthcare worker would know that this person now needs to go to a mental health worker so that they can be followed up to get to the bottom of what happened, and also to make sure that it doesn't happen again. So that is another one where investment needs to be done. I think much more also needs to be done for young people. And we do have guidelines. We do have, WHO has guidelines called Live Life, that are suicide prevention guidelines that look at the different areas where a focus could be put, including the regulation of organophosphates, the means of suicide, as well as what programs could be developed for young people, school-going young people, to prevent suicide. So I think there's much more that could be done, especially for young people 15 to 19, 15 to 24 years of age, in preventing suicide within that age group. Because for all regions of the world, actually, suicide is about number 4 for that age group. If we look at causes of death, including in the African region. Yeah, so it's important that we begin to invest more in prevention for that age group.
You mentioned taboos, and I just wonder, the stigmatization, the taboos, it sounds as if maybe a societal intervention is also required, perhaps through traditional leaders, churches, and other structures, to help change society's thinking around suicide.
Definitely. I think definitely you hit the nail on the head. One of the biggest barriers that we have has to do with whether somebody would be buried if they die by suicide, whether they get a proper religious burial or not. And of course, everybody would want their relative to get a proper religious burial. And so because of this taboo around, and I think the practice, religious belief around cause of death and whether somebody who has died by suicide should get prayers and a proper religious burial, that too is a problem, because if religious authorities themselves are not willing to pray over a body that was probably suffering and most needs the prayers, somebody who dies by suicide, one imagines, has reached a severe level of pain that they come to this. So if the religious leaders are not willing to say this and to pray over that body, then that is a pity. So we do have to raise awareness about and change the taboos and the beliefs around suicide.